Hey, this is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. Can't see my mouth here because I'm in the office. There's other people in the office, and we want to make sure that we're being safe. So maybe I'll put some captions on the bottom so you can read the words here. And so, as you can see, my hands. 1 second here. Gotta wash my hands. Hand sanitizer, touch my mask, and on the sanitizer point, okay? Very, germaphobe is not a word that is a bad thing at this time. So, purpose of this video, once again, my name is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. Here, fortunately, just to timestamp this video, Governor Newsom just announced another shutdown here of non-essential services, primarily indoor non-essential services. This is, and today's July 14th. And, I was really hoping that the economy would open back up. I'm going to go like this to adjust. And hand sanitize. I was hoping the economy would open up, and I was hoping that people, were going to be responsible. And from what I've seen a lot of businesses take things seriously in terms of trying to at least give their employees the basics and what they need. But for certain businesses, supermarkets, things like that, I think people are expected to follow the rules. You go in certain things. I went in certain gyms. I'm not going to say the gym's name, but went there, and you know what? They have the mask policy, and then as soon as you get in, everybody's maskless. So if you want these policies to work, you have to be responsible. Okay, so with that. Purpose of this video, why should you take care of your underlying health concerns during COVID-19? My reasoning, my position behind this is in the fact that, one, many patients who have either suffered severely from the virus have had underlying conditions. And a lot of people don't understand an underlying condition can be something as, I don't want to say something as simply complicated, right? Because it's not just simple. It's something as simply complicated as high blood pressure. And I think, oh yeah, I'm just taking medications. I'm just taking my meds. That's an underlying condition, right? And I had a patient recently who came in with let's just say their blood pressure and pulse were not ideal. Within the first two treatments, they had high blood pressure, and they had one high blood pressure reading, and there was a possible tachycardia. It was possible they had tachycardia, which is an increase in the heart rate and the heartbeat. And bradycardia is when the heartbeat slows down. And so they were experiencing these symptoms within the first two treatments, and then the third treatment, blood pressure is stabilized. It is within a safe level. Oh, take care, Carrie. Say bye to our awesome administrator here. So, blood pressure comes down, is stabilized, heart rate is stabilized. It was going over 100 beats per minute. We were able to get it in the low 80s. I think somewhere in the 80s, right? So, now this patient's concurrently doing other treatments, but, I've seen enough patients tell you that no matter what, you're gonna try to figure out what that works. We can decipher. If you spend enough time, you can figure out what's gonna help and what works. But no matter what, it's taking those steps to get treated and working with someone who's experienced in terms of, I work with patients to help them completely I've taken an oath as an acupuncturist, and I cannot say something that's a lie or false like that. I have worked with patients, not all my patients, just a few patients, to help them completely eliminate their use of blood pressure medications and diabetic medication or diabetes medication. Right? Type 2, right? Not type 1, not juvenile diabetes, but um, preventable diabetes. Right? Help them to completely not need any metformin or any kind of beta blocker or anything like that. So and there's a process. You just can't quit. So that's why you have to work with a healthcare provider. You can't just listen to stories, and you have to work with a licensed healthcare provider who has done that, who's had the experience. Right? Don't just listen to this someone who's just told you to take this herb or this or that. I should record another video about take this herb, take this, take that. No. So what I'm trying to postulate, what I'm trying to suggest is that if you can take care of some of these underlying conditions, maybe overall it could possibly, right? It's no guarantee it could possibly help in outcomes, right? Treatment outcomes, should you contract the virus or anything like that. And so that's why it's not a matter of there's a special pill. There's no cure. There's no vaccine for COVID, right? Uh, at this time, okay. You might have heard treatment methods and things of that nature, but they're not approved and not authorized here in the U.S. At least here in the United States. So, as far as to date, we don't have any cure. We don't have any vaccine. Treatment is in the treatment of the symptoms, and prognosis depends on obviously a whole lot of conditions. So hopefully this gives you some motivation, some insight in order to continue doing your telehealth. Even though gyms may be closed, some facilities may be closed, still take the time to go do your walks, still do your exercises. And we are trying to do our best. Carlos St. Jess, licensed acupuncturist, is here to help you out, to help you become a stronger person. Looks like people are leaving, so I'm going to take off my mask here. Become a stronger person. And then I got to clean out the room here because I took off my mask. There's a decontamination process, right? It'd be different if I just said, la, 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 I took off my mask. And see, if you're taking the precautions, then maybe you have a better chance of being able to do things. But I think as a society, we need to come up with some really strong ways. If we want to really open back up, you're gonna have to come up with some really strong habits and ways to enforce and ways to remember. A lot of people forget. Sometimes you go somewhere, you touch something, you forget to wash your hands, all that other fun stuff, or you forget to put on your mask in the vicinity of other people. You might say it's okay. Whatever the case may be, we always have to account for human error, right? And a smart person will create a device or a technique or something that will account for that and help us out as humans. Thank you. Have a very, very safe week. Hopefully this video finds you well, and peace.